Healthcare, as you know, is very personal. What is important to you may not be important to me, may not be important to the next person. If you're younger and you're in my world back in the day, you graduated from college and I don't know, maybe I'm 32, I finally went back to the doctor and that's when I started caring. I care a lot more now about going to the doctor and all of those kinds of things. And so today we've got some major changes coming up with the health plan. I'm going to touch on those as we go through a presentation. Some of it I'm going to go through quickly. Some of it I'm going to take my time. Questions. The first part as we go through is why the changes. What's going on? Why the changes? Second part is going to be an overview of what those changes are. And I'll probably go through those kind of quick, and I'll have you hold your questions until we get to the details, because someone will answer some of those questions that you have. And then member communications that you're going to be receiving. I actually received one yesterday. Some of the other folks would also, over the weekend, potentially receive them too. And then again, I'll follow up with questions, and if I'll stick around as long as possible. My name is Ike Loveless. I run the health plan. I'm the executive director and plan administrator. With me to my right, many of you have probably spoken with Anne-Marie Drawn. She is extremely knowledgeable. She worked at Index for 20 plus years. Came over and worked with us 4 years ago. 3 years ago? Fourth year. And she has a ton of knowledge about the health plan history, things like that as well. And she's one of the better troubleshooters that we're going through things. All right, why change? The health plan over the last 2 years, we've seen an increase of almost 30% in our large claims. Large claims to us are claims $50,000 or more. Okay, big numbers. To put it in perspective, we have 10,000 employees, so about 25,000 covered lives. Okay, right here in Orange and Ulster County. We have about $120 million in medical claims, about $46 million in prescription drugs. Okay? Those are big numbers when you think it's just our little local area, only education that doesn't include all the other employers in the area. Okay? Multiply that across the state, across the nation, and you quickly understand why it's such a hot topic. Steep increase in prescription drug costs. Our prescription drug costs continue to rise, probably on average about 12 to 15% a year. Medical inflation is closer to 3% on average as you look at those same things. It's why when you watch the evening news, every single ad is a prescription drug. It's about half the ad is all the good it'll do for you, half the ad is about all the other side effects potentially. Okay? There's a variety of things that are going on that affect all of the costs and claims that the plan is incurring. Getting political for a second, you had Obamacare come in. Mary Lou would tell you that she sat through enough of my presentations that if I raise your office's co-pays $5, it saves the plan almost $1 million. So think about Obamacare, okay? Now we all have all this wellness that's free. That's great. Back at the plan office, those $25 co-pays disappear. How do I make those up? I've got to raise premiums. Okay. How many of you have kids who've benefited from being on the plan up until age 26? Quite a few, right? I love that. Because dummies like me who run the health insurance aren't going to go back and figure out, okay, here's what it costs to carry all these kids up to the age of 26. And where's that go back? Back to the premium. So all of the talk about, oh, they're covered for free now. Well, not really, okay? We all are smarter than that. At first, we're like, this is great, but we know that eventually somebody's got to pay for it. And, oh, by the way, there's a lot of reasons, and a number of these kids, that we can better manage plan funds, okay? And when I say we, it's both as the plan as well as you as a consumer. What other good do you go out and buy that you don't even ask what it costs? I mean, there's not many. Very, very few examples. What you want to know about is what your copay is, whether that's $25 or $35 under our current situation. But to you, it doesn't matter if it's $10,000, $12,000, $15,000. You know what your copay is. So how to get you guys to be better consumers of healthcare? I put up here generic drug use is a very simple example that we always talk about. Okay. Here's some of the changes on a high level. School district premiums July 1st are going to go up 18%. When we started the process, this number was closer to 27%. We cut out almost 10% through the changes you're going to see. Many of us are taxpayers, and obviously this goes into school budgets, and I know it's a trickle down all the way to that point, but I can assure you we all are picking up a piece of it as taxpayers if you're within one of these school districts. First switch, we're going to go to a new pharmacy benefit manager, or PBM. It's CVS Caremark. I'm going to try to make a distinction for you of CVS versus Caremark. I want you to think of CVS as your local brick and mortar CVS that sits on the corner of the street. Caremark is a more overarching umbrella. Okay? CVS slash Caremark, and here it's named Caremark, has the largest network of pharmacies in the country. Roughly 95% of all pharmacies are in that retail network. So for your acute care drugs, think antibiotics, you can go to any of those retail pharmacies, okay? Whether it's Walgreens, Rite Aid, certainly CVS, independents, grocery chains, you're hard pressed to find a pharmacy that doesn't participate, all right? Your retail preferred brand name drug copays are going to go from $25 to $35, and these kind of fall into two categories. One where there's only one drug that treats the condition that you happen to be taking that medication for, or, and that's where preferred comes in, is you're taking one of the drugs that is preferred, either for how effective it is at treating it, or the cost of the drug compared to other alternatives. Non-preferred drug brand name copays are going from $50 to $60, okay? Non-preferred, that means there are other drugs out there that treat whatever illness, disease, things along those lines that you are taking that medication for, and they're much cheaper. And as a result, you're going to pay a larger share of it. Okay? And again, I'm going to go into some additional detail as we go through. Maintenance medications, your mail order pharmacy. Right now, you pay 1.5 times the retail copay, but you get 90 days supply if you use our mail order. Okay, so it's half off, basically. What's going to happen now is you're going to go to 2 times the retail, so you're going to save 33% for a 90-day supply. All right, so a generic drug, if you pick it up at your local pharmacy, is $5. 90 days costs you $15 at your retail pharmacy. Mail order used to cost $7.50, it's going to cost $10 now. But again, you save $5. Same, we'll have a chart that illustrates it better. All maintenance medications, think chronic long-term illnesses, blood pressure, cholesterol, thyroid, all of those kinds of long-term illnesses and drugs you're going to take the rest of your life must now be filled in one of 2 locations. One through the mail order pharmacy, which is Caremark, or 2, your local CVS, and CVS stores only, including the one in Target. You will not be able to fill your maintenance medications, things that you take every single day, at a Rite Aid, at a Walgreens, at your independent, at your grocer, at any of those things. You must use mail order or your local CVS. Do I have any Medicare primary people in the room? Okay. So that'll be a little bit of that. We are going to allow you up to 3 fills at any local pharmacy. prescription at the mail order or at your local CVS, or if it's a new prescription. You know, I talked about how some of these prescriptions are very expensive. We have one in one of our school districts, person has over $1 million, if you can believe it, a year in pharmacy expenses. And on average, our group as a whole, we have people taking 6 30-day supplies of medications on a daily basis. And it's hard to believe, but it's amazing. That 3 fills, obviously with the expensive ones, the second scenario there is we don't want you getting a drug that's $1,500 worth getting a 90-day supply, only to find that you wake up in the morning and you're covered in hives from an allergic reaction, and now I've got $5,000 worth of medication sitting in your medicine cabinet. Okay. Another big one, and I have not gotten as much feedback from people as I thought I would on this. If a generic drug is available, you must take the generic drug. If you take the brand copay will apply, plus that you're going to pay the whole price differential between the two. Prescription drugs, available over the counter. Okay. Some of you have found there was a loophole in the previous system that if your doctor wrote you a script for, pick a drug A, that you could get it at the copay as opposed to buying it for $15 or $20 off the shelf. And what would happen literally is your pharmacist would come around from the counter, grab it off the shelf, put it in his bag, run it through, and away we go. Just like you were buying an aspirin almost. Okay? We've closed that loophole so that if it's available over the counter, you cannot buy it through your prescription drug plan. We're going to talk about a caveat with that here once we get to the details. Also, something new, we're introducing Anthem Blue Cross Blue Shield. It's a live health online telemedicine program. $10 per visit. It will be available to you through your laptop, your PC, your phone, your tablet, any of those kinds of things. Also, as I mentioned, we try to balance what we can do as far as making you better consumers, and obviously there's some takeaways here. We've tried to give a few things back to help as well. We understand that it's not cheap right now in healthcare. We worked a direct contract agreement with Quest Diagnostics, in that if you utilize Quest Diagnostics as your laboratory service, instead of a $25 copay, it's only going to be $5 because of the advantageous pricing in that contract. Okay, you can have your doctor send it to Quest rather than LabCorp's own, that kind of thing. And then also, this is just about finalized. We're working on the last part of a similar type of direct contract arrangement with a company called U.S. Imaging. They operate 8 different radiological facilities in the area, all focused right around the health centers that are in Orange and Ulster County. If you utilize one of these U.S. Imaging networks, you will have no copay. And that's going to become important to you in a minute once we get to the next slide. But think MRIs, CAT scans, that kind of thing, PET scans, that kind of thing. I'll get back to it once we get to the details, so just hang on one second. Here's some other changes. We are going to implement a $100 per visit to the hospital. So whether you're there for 2 days or 10 days, it's a one-time $100 copay. The ER copay is going to go up to $100 from $70. The hospital radiological test copays, charges, things along those lines are going to go from $35 to $50. And then how many of you utilize urgent care? I know I'm one of them, or walk-in care. That's going to go from $25 to $35, and in the details here, I'm going to explain the whys and how comes. All right, we're into the details, so now I'm going to take questions as we go on a slide-by-slide basis. So CVS Caremark is going to replace Envision as our PBM. Again, I mentioned here, Caremark's network of pharmacies, brick and mortar pharmacies, is one of the largest in the country. Roughly 95% of all those pharmacies participate. All right? They include the Walmarts, the Rite Aids, the Walgreens, Sam's Club, Costco, your independent farmers, pharmacies, and groceries. All your prescriptions, mail and retail, have been transferred over to Caremark's programs. They're being loaded into the systems now, so they will be aware of it. Their phone lines are also open. If you call now, they will know who you are, and your eligibility will pop up on their system. If you need to find the CVS retail pharmacy, you can go to cvs.com/pharmacy. It's a store locator. My very first presentation I gave was in Port Jervis. Their closest CVS happens to be in Middletown. Cornwall's got one. There's quite a few. Where I live, it seems like every other corner there seems to be one. But nonetheless, you can go on here. Probably more likely to use that when you're on vacation or something along those lines. Caremark's formulary, which is the list of covered drugs, is very similar to Envision. So if anybody's gone through a prior auth, that's okay to get a specific medication with your doctor. Okay, they're similar, but they are not identical. Okay, so you may get a letter about the middle of the month that talks about, hey, you're taking drug A, our preferred drugs are B and C, and all the information you need to get a hold of your doctor and get a prior auth set in place. Caremark's going to notify members via mail that prescriptions don't match. That's that personalized letter. And your doctor can call Caremark for a potential exception, authorization, override for certain drugs. It will be based on medical necessity. Okay, so he's going to have to come up with something other than, hey, this is my preferred drug. Okay, well, why? How come? If I get nothing else across to you today, the next month, open your mail. You're going to get mail from Orange Ulster OU Health. You're going to get mail from Index. You're going to get mail from CVS and Caremark. Open your mail. Don't just take it and toss it to the side. There's going to be a lot of important information, including new cards that are going to be coming to you. All right. Here's the screenshot of the savings available to you. Retail preferred brand name drugs. We talked about 25 to 35, non-preferred 50 to 60. The chart below here talks about the maintenance drugs, how it's going to be 1.5 times. So preferred brand name drugs are going from 25 to 35. So if you get it at a retail pharmacy, it's $35. If you get through the mail order, a 90-day supply of that maintenance drug, it's going to cost you $70, but it's still going to save you $35 over what you would have spent if you were still able to get it at a retail. 60 non-preferred. And again, these are medications prescribed for long-term care and use. Blood pressure, cholesterol, thyroid, all of those kinds of illnesses where you take it day in, day out, probably likely for the rest of your life. And they have to be filled at mail or your local CVS. So those are the only two outlets that you can get those from. Any questions there? Okay. You can use any other pharmacy you want, your Rite Aids, things like that, for your acute care needs. Think antibiotics, short-term Z-Packs, stuff like that. Okay. Okay, again, if a generic drug is available and the member chooses the brand name, the member must pay the brand name copay in addition to the difference between the costs of the drug. A great example here is Nexium in the purple pill. Okay, that's a proton pump inhibitor or a PPI. It costs the plan about $300 a month for Nexium. There's about 10 to 12 other drugs that treat that disease, that illness, that roughly the same way, that costs $26 per month. Okay, and so again, this is to try to help you be a better consumer. If there's a reason, let's say medically there is some reason that you can't take drug B, and you do have to take drug A, doctor can submit for prior authorization to try to get coverage for those drugs, but it's going to need to be based on medical necessity. All right. Another piece we talked about, the over-the-counter, I said there's another caveat. Okay. This applies only to prescription drugs equivalent in dose. So we've all been out shoveling snow here. Last April it was, when we got all that snow, your back hurts, you go see your doctor. They give you an 800 milligram dose of ibuprofen. All right. We know you can't go get a single pill that's an 800 milligram dose of ibuprofen at your local drugstore. We also know you can take 200 milligrams, but you want to be able to eat dinner as well. Okay. So that's a great example. 800 milligrams, you need a prescription to get it. You can't go pick it off the shelf, even though you could take 200s. But that's a good example of equivalent in dose. Okay, is that clear? CVS specialty pharmacy, think high-cost drugs, okay, is going to be the only place you can get any specialty drug filled. We have a certain injectable I know of that we've had some people on. They go to their doctor, get it injected. It costs the plan about $6,000 a month. CVS's specialty pharmacy will ship that same drug either to your home, to your local CVS, or to your doctor's office, to which you can take it to the doctor. They'll inject it for about $150 cost, and the plan fill for that same drug is about $2,000. That's on a monthly basis, about a $3,000 change savings. That's $36,000 over the course of the year. And you can start to see why we're trying to be better managers of how we're utilizing it. Okay? And we've tried to leave as much flexibility as possible. Part of the specialty pharmacy, they have access to providers specializing in your care, MS, whatever the malady you seem to be having. They have on-call pharmacists 24/7, and they will coordinate the care both with you and your doctor. We talked about where you can get the drug. Everybody and their brother has support online. You can always go online. Anybody taking the specialty pharmacy, they always go, well, how can I call? Because these are very expensive drugs. They're great drugs.